Hello, everyone. Today, I have the honor of interviewing Dr. Joseph Witt-Doring. Dr. Joseph Witt-Doring is a board-certified psychiatrist and a former FDA medical officer with a specialization in identifying and treating psychiatric adverse drug reactions. In 2020, he co-founded a private practice dedicated to assessing and treating patients suffering from these reactions. Now, at the Health of Life on Less Meds podcast, Dr. Joseph is vigorously proactive in challenging the harmful effects of psychiatric medications. He shares daily content on how to safely navigate drug tables and heal from withdrawal. Welcome, Dr. Joseph. It's an honor to have you on this channel.
It's a pleasure to be here. Thank you for having me.
Okay. So, first of all, tell us more about who you are and what brought you into doing what you do today. A psychiatrist who ends up prescribing meds instead of prescribing them. Tell us more about your journey and your career.
Sure. So I ended up interested in psychiatry because I was really interested in people. What made people unhappy, what made people thrive, and so I wanted to understand that for myself, and I wanted to understand it for others. And so when I was in medicine, going into the field of psychiatry seemed like a really good fit. But though, as I started to train in psychiatry, I realized we really didn't do a lot of that. I mean, we talked about it. We said when we evaluate patients, we look at, the biology of what's going on, but also the psychological things and the personality and the social and the environmental factors. We would talk about all of those things. But really what I saw being practiced, and I trained in the United States for psychiatry, really wasn't that at all. There was very little attention given to non-drug therapies, so things like understanding the psychological reasons why people are unhappy or the environmental reasons. And the medical practice had become the psychiatric care had become very transactional. We would just see people in 15-minute visits and usually just prescribe medications. And that just seems very wrong to me in many ways, because a lot of the mental health problems that people deal with, I don't think are mostly biological. In fact, I think the opposite. I think a lot of the reasons why people are unhappy have to do with life hardship and things in their environment. And so it felt wrong to be neglecting that. I mean, we would talk about it a lot, but we wouldn't ever do anything about it. And so I left my training very concerned about how much medication we were prescribing people and how quick we were to prescribe without really understanding them. And I wanted to learn about drug risks, because that's always the equation. What is the benefit of the drugs and what are the risks? And I felt I really didn't understand the risks. And because of that, I went into the pharmaceutical industry, and I worked in drug safety for multiple pharmaceutical companies. And then I also worked at the FDA, reviewing the safety of the drugs on the US market, and sort of understanding how regulators and scientists understand the risks of the drugs. And as I was there, what I began to realize is that they weren't really paying a lot of attention to the risks of the drugs. I think a lot of serious risks, especially less common ones, were being missed. But also they didn't care so much as to how medicine was being practiced. And so having seen the overprescribing in medications and I guess the lack of attention that drug side effects and drug harms were having in the pharmaceutical industry and also at the FDA, I decided I wanted to help people recover from medications when they were getting hurt from them, because a lot of people were having difficulties coming off. And so that's sort of my story and how I ended up doing a deprescribing clinic.
Great. So tell us more about your work in the FDA. How a drug is approved by the FDA? What is the process of approving psychiatric drugs in the FDA?
Sure. So in order to get a drug onto the market, you need to have two randomized controlled trials. Now, for essentially all of the psychiatric medications, these are 8 to 12 week studies, and this is for antipsychotics or antidepressants. It's
Wow.
usually within that range. And the research is pretty good, at least for the first 8 weeks when they're looking at it. But the big gap in the FDA is that they don't really look at what happens to these drugs long term. Now, most people on antidepressants are taking them for at least 2 years. That's the median duration of use.
Mm-hmm.
And we're only studying them for 8 weeks. And the big problem that I see with that is when you practice clinically, what happens with a lot of these medications is they actually wear off um, because the neurotransmitters that they act on, whether it's serotonin or norepinephrine,
Mm-hmm.
these aren't just small things that cause changes in our mood and our anxiety in our brain. They affect our entire bodies. They control the way our heart beats, our immune system, how our digestive tract works. And when we take drugs that interfere with that, it puts the body out of balance. And so the body pushes back against that and it sends signals up into the brain to adapt to the presence of the drug, to fight off the drug effect. And that was usually what I saw with a lot of long-term psychiatric medication was from about 6 months to 2 years, somewhere in that range, the dose wears off. And then so people end up in this place where many of them, the drug's not working, and then you have to go on higher and higher doses, and then you're at risk of more and more side effects. And so if I were to talk about the drugs being approved at the FDA, I would say
Mm-hmm.
they've got good evidence for like the first 8 weeks, but then we really don't know what happens to a lot of people after that, and that's a huge problem with how we're using the drugs these days.
Yeah, it's really really strange to know that they are only studied for 12 weeks, while on average people take them for years. So for any other drugs, they run trials for clinical trials for several years. For example, statins, for example, they run
Hmm.
clinical trials for several years to study these drugs. But with psychiatric drugs, they only do it for 12 weeks. So it's really, I feel it's like scandalous.
I do, and it's a very large gap in the research, and one of the biggest things, I mean, one of the biggest white lies that we tell people, and I hear this in the US a lot, we to say antidepressants are safe and effective, but what we forget to tell people is for the 8 weeks that they were studied, we miss that last part of the sentence, which is really important for people to know.
And it's so funny also because most psychiatrists tell the patients that the drug will start working after 2 months or so.
Hmm.
So
Yeah,
it's so funny.
yeah. Yeah, it is a scandal, and this is one of the things that really upset me about the FDA and made me lose a lot of confidence in them. They should be playing a more active role in requesting this information from the pharmaceutical industry. They should say, we are no longer going to approve drugs unless you give us clinical trial evidence that is in line with how people use these medications. And don't get me wrong, like I I'm criticizing the research, but I can also talk about what they do from a clinical perspective. And for some people, they really do work. I mean, these are medications that are numbing. They can be
Mhm.
stimulating for some people, and they can help people sleep. Depending on the person and the problems that they're having, they may be useful effects. And not everybody becomes fully tolerant to the drug effect. We've got some people, and they take it, and it works well for a very long time, maybe even their whole life. We've got some people where the drug effect wears off and they don't really know what it's doing anymore. I hear that a lot. And then there's some people who get worse. And so the clinical trial evidence doesn't tell you a lot, but clinically just using these drugs, what I can say is yes, it does work for a group of people, but you can't predict who that is. And
Mhm.
there's also a large group of people who aren't getting a lot of benefit from it.
Yeah,
Yeah,
that's true.
yeah,
But I believe, first of all, we need to talk about the Holy Bible of psychiatry, the DSM.
sure. Okay.
Okay, so I read a lot and listened a lot to James Davis, if you know him.
Hmm.
Um, in his book, Sedated, he says
Hmm.
these words. Um, the DSM, it increased the number of psychiatric disorders from 106 and six in the early 1970s to around 370 today. And by progressively lowering the bar for what constitutes a psychiatric disorder, making it easier for any of us to be classified as mentally ill. These processes resulted in much of our everyday human distress being wrongly medicalized, pathologized, and eventually medicated. Grief at a significant loss, a struggling to reach orgasm, experiencing a lack of concentration at school, undergoing trauma, feeling anxious on public events, or simply underperforming at work are just some of the manifold painful human experiences that the DSM has medically rebranded as symptoms of psychiatric illnesses. So tell us what you think about that, and also tell us about the history of DSM and how it evolved.
Sure. Yeah. So the DSM, what I'll say about it is it's very misunderstood. Really, what the DSM is at its heart is a dictionary where it defines certain mental illnesses. And so, for instance, it's a book of labels where if someone reports certain symptoms, they get a diagnostic label. Um, and so it can be a way to just categorize people who have certain problems. Now, there's nothing wrong with that. The problem that has occurred with the DSM is what James Davis says, is that it's frequently used to medicalize people. And so instead of people hearing like a DSM label, let's talk about major depressive disorder. Now, if you look at the diagnostic criteria for that, it's just a list of symptoms that were voted on by people.
Mhm.
Many people in the public don't know that. They think this is a biological problem, because it has a very medical sounding name and it's coming out of a medical textbook. Major depressive disorder. There must be something biologically wrong with me. And so when you so a lot of it comes, I think, from the misunderstanding of what these labels mean, and the way it has become so poorly, so misunderstood is by a lot of pharmaceutical marketing. Now, drug companies have a very vested interest in having people see their sadness as medical problems. And so you'll see things in the news or in newspaper articles or in the United States on TV where they'll talk about, well, if you're unhappy, you may have a chemical imbalance. And so they favor this explanation of psychiatric problems that is biological. And a
Mhm.
lot of people then understand that. And so when the DSM comes along and now they create um, 371 labels or whatever it is, it's just more opportunities for vested interests, whether it's drug companies or people who want to promote treatments for those things, to grab those disorders and then to misrepresent them as being solely biological. Um, and a lot of this is also helped by a medical system that preferences very transactional medical visits, right? Because if you're seeing someone in 15-minute visits, you're not going to talk about all of the complicated things going on and try and understand their psychology and their past trauma and their environment. You'll say, okay, yep, major depressive disorder, we're going to use a medication. So there's all of these forces that work together to to make people think that when they get these labels from the DSM, they have a medical problem when the biology of the illness, I think, is just a small part of it.
Mm.
And so I mean, that's my take on the DSM.
Yes, I believe so. For example, if we are talking about depression, um, to explain the situation here in Egypt, Egypt has a very hard problem with poverty and unemployment and all of that. So
Hmm.
if a young man is struggling to find a job and to get married and all of that, uh, I love Jordan Peterson when he differentiates between when he talks about depression, he tells people that are you depressed or you are just having hard times? Okay.
Hmm.
So I believe my own opinion about depression is that depression is just a normal brain reaction to difficult circumstances in life, not something
Hmm.
not something ill, not something chemically imbalanced.
Yeah. Well, it's interesting you bring up Jordan Peterson because, and I don't know his story intimately, but for many years he did think he was depressed and he did take antidepressants. Then he went on this carnivore diet with his daughter,
Ah,
and he said it
Michela.
really improved yeah, he said it improved his health. And so the other side of depression is it's there's a lot of things that can cause it, which the medical community is simply not interested. And one of the big ones, I think, are dietary problems. The
Mm-hmm.
amount of there can be very inflammatory foods, things like seed oils. There can be people who have sensitivities to gluten and dairy, where if for whatever reason you're just very sensitive to these products, you become very inflamed and you develop autoimmune problems. It affects your mood. Um, and we never, well, I don't know what happens in Egypt, but at least in the US, we never talk to people about diet.
Of course.
And currently, there is a huge interest in using anti-inflammatory and ketogenic diets in helping people who have very severe depression. And I've seen it. I've seen a lot of people who have been on medications for decades come off because they changed their diet. And so depression ends up being this thing as well where there's medical problems that are making people look sad, and they're telling them, oh, you have a biological problem with your brain, but it's actually unrelated. Like
Mm-hmm.
for instance with Jordan Peterson.
Yeah,
Yeah.
yeah, it has nothing to do with lack of serotonin and the
Mhm.
SSRIs being increasing this lack. So since we talked about diet, we have to mention Chris Balmer's and his work, Brain Energy, uh, when he
Mhm.
talks about that psychiatric illnesses is just mitochondrial dysfunction in the brain. I read his book and it was like mind blowing for me because
Mhm.
it explained a lot of things. It's like the theory of everything. It's like offering a theory of
Mhm.
everything. It's really amazing. So tell us more about
Mhm.
what do you think about the role of mitochondrial dysfunction in mental illness?
Well, I think for some people who are having these problems, it's clearly really important. Like I said, I've seen some people drugged for 20 years on ECT. They looked like they would never get better, miraculously improve and never have mental health problems again when they changed their diet. And they did anti-inflammatory ketogenic diets. And so there are some people where, yes, it could be that. And they've also looked at things like insulin resistance and diabetes, where if you're eating very, very sugary foods, your body is going to secrete a lot of insulin. And the body then builds up a tolerance to insulin. And insulin is the hormone that tells the cells to pull sugar out of the bloodstream and you pull it into the cell and then use it for energy. But if you constantly have very high levels of insulin because you're eating a lot of sweets and sugary foods and carbohydrates,
Hmm.
you're going to develop insulin resistance. And what that means is the cells become unable to pull food into them. And so by going on these ketogenic diets, which restrict carbohydrates and sugars, you're able to then have normal insulin levels again. It recovers, and then you actually get more energy into the cells. And so people can improve in that way. I don't know if I would say too soon to say if it's this unifying theory that helps us understand schizophrenia and bipolar and all forms of mental illness. But I'm comfortable saying that anybody who has psychiatric problems and it seems to come out of nowhere, it's not linked to stresses in their life, or the stresses in their life don't seem like they're at the magnitude to be causing the level of symptoms the person is having, they must do an anti-inflammatory ketogenic diet. They have to try it just to see, because the results, they can be outstanding, and you really only need to do it for about 3 months, and it's going to be just a lot better for you for your entire life than taking medications.
Yeah, my own experience with this, that earlier this year, that I had some symptoms of depression, because I was just out of I've just finished my military service, and it was a very hard time during that year. So I was out of shape. I gained some weight and all of that. But when I returned to the gym and start taking, for example, the famous supplement, creatine monohydrate, and other supplements, it was therapeutic for me. The symptoms of depression went away, and my enthusiasm about life returned. So, do you think that supplements like creatine monohydrate and different kind of supplements can delay can substitute the need of antidepressants and some of the psychiatric drugs?
It's a complicated area. I haven't specifically looked at creatinine, but I do know that a lot of people say it has mental health benefits. My take on this is that there's a lot of people out there, I think, who look at supplements and they see it as kind of fake medicine, as it's not real medicine, because if it was, doctors would be using it. And they're also very suspicious of it. And I get it, because the supplement industry is unregulated. So there's a lot of people who make a lot of claims about these supplements, and some of them are exaggerated, for sales. And so there's also this suspiciousness about it. But I can speak from, but so there's two things that I want to say. One is, I think supplements have the most evidence of helping people when they have true deficiencies. And so if you're deficient in like B12, folate, zinc, vitamin D, if you're not getting enough fish and you're low in omegas, all of these things have been shown to improve mental health for people when you balance them. And they're very low risk. I mean, if you do it correctly, they're not really going to harm you. And so testing for these vitamin deficiencies and then replacing them can be a really good strategy for people. And the other thing that I would say is also with supplements, and so I take supplements as well. I like taking, NAC, I take lots of antioxidants. It works for me. And there's no clinical trial out there that's going to say, this made someone feel better in this way, because you can't really patent them, and so you can't make a lot of money from them, and so no company's ever going to invest in the expensive clinical trial to look at it. So I also think of supplementation as kind of, you have to experiment on yourself and keep an open mind, try a few things, and then you'll know if it works on you. Because for me personally, I do take some supplements, and I think it improves my energy levels.
Yeah, great. So we need, of course, to talk about SSRIs in more details.
Sure.
What do you think the best use of SSRIs, and if you would prescribe them for your patients, what is the best use? And also, we need to talk about the adverse side effects of them, the BSSD, and all of that. Tell us more about that,
Sure.
and I will continue.
Yeah. So SSRIs are drugs like Prozac, Lexapro, and that class. And so many people think of them as antidepressants. And when I say that, I say it because they interpret that the drug is going to fix their quote unquote depression, which is whatever is making them feel unhappy, whatever symptoms they're having. Each person understands depression to be different. It's just sort of unique to their experience. And they say, well, this drug is an antidepressant. I'm going to assume it's just going to fix these symptoms. That's the wrong way to think about SSRIs and a lot of antidepressants because they don't fix anything that has to do with the underlying reason you're depressed. What they do is they create drug effects. That to me is the only logical way to understand what they do. Like how alcohol may make people feel buzzed or euphoric or happy. An antidepressant like an SSRI will have a drug effect. Now, what I see clinically is the most strong drug effect that it has is one of blunting, and so it will turn down the volume on the intensity of your emotions, and that can be really therapeutic for some people. If someone is living in a state of constant anxiety and it's getting in the way of their life, if you take something and it kind of turns it down from a 10 to a 5, that person's going to look more functional and it'll be helpful for them. The other effect that that SSRIs have, and this is to a lesser degree, is they can be a little energizing. And so it can give people a bit more energy to do things. So I think about the drugs as having those two effects. The challenging things with these medications is not everyone responds to them in the same way. Some people feel a lot of the numbing, and some people feel more of the energy. And we can't really predict how each person's going to feel, but mostly people feel kind of numbed out a little on them. And so that's how you use them. So you would interview someone and you would find out, how much anxiety are you having? And for me personally, when someone's having a lot of anxiety, that's when I think the SSRIs are the most useful. Now, the challenging thing about it is, as a psychiatrist, I know that a big group of people are going to become tolerant to this drug. And it could potentially make them worse. I could put them on it. It could work well for 6 months and then they need a higher dose. And then a year later, they need a higher dose. And eventually they run out of room. They start having side effects to the medication or they have to add a new one in there. And because I know that the long-term journey on this medication, there's risks in there. And I don't really want someone to be fully dependent on a high dose of the medication and it's not doing things. Because of that, I only reserve it for people who are really, really sick and suffering. And if we've done absolutely everything else, we've looked at their relationships, we've looked at their work, we've looked at their diet, and we've done these different strategies to try and address them. And if they're not working, then sure, you use an antidepressant if that's really going to help the person. And so that's how I think about using those medications.
Okay, so I can see that they are just short-term solutions. For example, if someone has been some problems in his life, we can give him SSRIs to handle these problems, and after solving these problems, we can taper off the drug.
Correct. Yeah.
Okay,
Yeah.
great. But of course, no one does that, and they just prescribe them for years. We need also to talk about the off-label use of SSRIs. For example, unfortunately, here in Egypt, many people use them for premature ejaculation. Daboxine, for example. So when I heard you talking about BSSD and all of that. I was really concerned. Does these people ruining their sexual life by taking SSRIs off-label for premature ejaculation? What do you think about that?
Sure. Yeah, so these drugs have strong effects on sexual arousal and libido, and they definitely can treat premature ejaculation because they make people more numb down there, and so a lot of people do use these medications for premature ejaculation. They're advertised heavily in the US for that as well. But there is a dark side to this, and the dark side is that some people will have sexual dysfunction long after they come off the drug. It is a very rare side effect, and it's called post-SSRI sexual dysfunction. And sometimes not only do they have, and sometimes it's very extreme, so that they'll no longer be able to have an erection. They'll struggle to have an orgasm. And on top of that, they can have a whole range of cognitive problems. It's truly a horrible problem. And for many people, they don't get better. Now, for a long time, these people were sort of dismissed when they complained about this ongoing sexual dysfunction that they developed from these SSRI medications. But recently, it started to be acknowledged. And so the European Union, which is the EMA, which is the Europe's drug manufacturer, the second largest in the world, they recently updated all of the labels of these medications to warn doctors about this. Hong Kong, Australia, Canada. So major health regulators have now updated the warnings. Um, and and this doesn't mean that you never use these medications, but what it does do is for me, it increases the threshold to using them. Because for many people, if they knew, hey, if I take Prozac or one of these other SSRIs, there's a rare chance that I could develop permanent sexual dysfunction. Many people wouldn't take them unless they were seriously
Exactly.
suffering, because they would say, I'm not interested in that risk. And so it doesn't mean you never use it, but it means that you have to be a lot more thoughtful about whether you even want to take that risk with this medication.
Yeah. So tell us also about the other possible side effects of when we stop SSRIs. What are the most common side effects that people struggle with?
Yeah, so most people, when they come off SSRIs, will have withdrawal, and so that's usually time limited. Sometimes it's bad for a month and then it goes away. Sometimes it might be bad for 3 months or so, but it's slowly getting better. And that's fairly common. And most people return to their baseline and they're okay. Um, I work in a very specialized area of this where we treat people who have a lot of withdrawal problems. And so another uncommon side effect that people have when they come off these drugs is they develop something called protracted withdrawal. And protracted withdrawal it's not like a normal withdrawal problem. And so in a normal withdrawal problem, if you remove a drug, you get symptoms. And if you put the drug back, the symptoms go away. Now, for this small group of people who, for whatever reason, are really sensitive to coming off these drugs, when they develop this protracted withdrawal condition, it's really like they've had neurological damage. And so for a small group of people, when they're coming off the drugs, it actually hurts their brain. And it does so in a way that I don't really understand. And it's like having a concussion or a head injury. After it happens, you can't just put the drug back and it goes away. That doesn't happen. Um, in fact, the whole nervous system becomes highly sensitized. And so people will have light sensitivity, ringing in their ears. They'll have burning in their face or their hands and their feet. They'll be stuck in a perpetual state of fear and panic. And just like a head injury, it can take a long time to recover. I've seen some people recover in less than 12 months, but I'm working with a lot of people where it's taking them several years until this injury improves. Now, the important thing for people to know about this is the most common time that this happens is when people rapidly come off the drug. And so if
Mm-hmm.
they taper themselves in like a month, or they stop the medication immediately, the severity of the acute withdrawal, and so you're going to have more acute withdrawal symptoms if you stop the drug faster, faster than your brain has time to readapt to it leaving. That the more severe those symptoms are, the higher the risk of having one of these brain injuries, these protracted brain injuries is. And so what we do is we taper people really slowly. And so for a lot of people who've been on this drug for, 2 years, 5 years, we may bring them off over 18 months, and we never taper them faster than their body can handle. We constantly ask them about withdrawal symptoms, and we keep on going in small increments if they're not having a lot of withdrawal. But as soon as they start to have a lot of withdrawal symptoms, we slow it down. Um, and typically, it's towards the very low doses of the drug where people need to go very slowly. And at that point, sometimes people use scales to shave down the pills to do smaller reductions, or they'll even get their drug turned into a liquid with a compounding pharmacist, and that allows for greater precision when you're lowering the dose.
Mm-hmm.
And that's the safest way to come off essentially most psychiatric medications is by doing it gradually and allowing your brain time to readapt to the absence of the drug.
Yeah, great. So I want to move on to talking about different class of psychiatric meds and psychotics. Okay. So do you believe that in some cases, um, with people like having schizophrenia and so, do you believe that chronic use of meds is warranted in these cases?
Yes.
Um,
Yeah.
tell us more about that.
Yeah. So there's nothing wrong with the drugs, is the first thing with all of them. What's wrong is how we often use them. And so let's say someone has a psychotic illness like schizophrenia, and they've done a very good medical workup, and they've done some dietary changes, but that person simply is not able to function without medication. In those instances, that's a good use of the medication because you've ruled out anything else that could cause problems. And then so it makes sense to use the medication in those circumstances. And so there are, each situation is unique. I think about, I mean, some people use antipsychotics when they have elderly parents because the elderly parents, they end up with Alzheimer's disease, they become paranoid, sometimes they're a little aggressive, and using that medication may keep them in the home for another year before they have to go to a nursing home. And
Mm-hmm.
they know that's what the person would want to just, take this medication and allows them to stay home. It's the same with children with severe autism. Yes, we want to do all of the things that we can do to try and help them with their irritability. But and yeah, sometimes it's helpful if you can have a helper there who can distract the child and soothe the child. But a lot of people don't have resources for that. And so then the parents are stuck in this situation where it's like, what do we do? It's very hard to care for the child without the medications. And so they may decide to use the medications long term in that situation. And so you have to look at each situation and the resources the person has and what they've tried, and then only use the medication. Unfortunately, a lot of the times someone comes in, they report the symptoms, and we give them the drug without trying to help them in ways where we would be able to reduce the amount of medication the person needs.
Mm-hmm. So, but I believe that the cost is so expensive when it comes to creativity, and I believe that psychotic illnesses is just uh, like it's a whole package. Creative people creative people have a tendency to experience these kinds of illnesses. So I believe it's so expensive for these people to ruin their creativity by prescribing antipsychotics. So do you believe that
Well,
there are healthy alternatives? For example, can CBT helps in convincing the person that these delusions are not real, and helping him to discern and differentiate between the sane thoughts and the insane thoughts that he's having? Do you
yes,
believe
yeah, yeah. So
John Nash, for
there
example?
are things like yeah. Um, there's CBT for psychosis is one way of helping someone live with the symptoms. Um, and another way of using these medications is just as needed. So I think about someone who maybe has bipolar disorder. Occasionally they become manic. It's totally up to the person. You just, if you want to, you can just use it when you're very psychotic, and then for the two months that's happening, you take the
Mm,
medication and then you come off, and then you stay off it until the next time. I don't believe everyone needs to be on the medication every single day. I think that's a really personal choice for people. And there are a lot of folks with schizophrenia out there who have had horrific side effects to the medications, and they've simply decided that they would rather live with the hallucinations and use things like CBT for psychosis. In the US, we have an active group called the Hearing Voices Network, and this is a community of people who have decided that they're trying to manage their hallucinations without medications. And that's very helpful to be in a community of people who are having similar problems and um, trying to deal without the medications. So yeah, there are there's a lot of different ways to cope with psychotic symptoms.
mhm. I believe that the best thing about working without meds is that you enable the person to express his agency in healing. Because I didn't just label him that you have this label of schizophrenia or bipolar, and you are doomed to be taking this medication, and there is nothing that you can do about it. But when I help him by using CBT and other methods, uh, I enable him to improve his agency and his responsibility towards recovery. So one of the worst things I see when I speak with some people who are struggling with these things is that their agency is removed from the equation. It's like they believe that like I am just ill and I have this problem, and they fall into some kind of victimhood.
Yes, yeah. It makes just when you have these labels and you're like, I have bipolar disorder, it's a mental illness, and this is the drug I take. Just like you said, people stop looking for other things. They start seeing their healing or their recovering as something that's done by the doctor and by the medication, where that's just a small piece of it, if it is even relevant to you. And there's so many things you can do on your own. And so I do think there's a huge problem with how we talk about mental illnesses and treat them. I think it does erase the agency and,
Mhm.
and and makes people feel like they can't that they're not involved in their healing, where they are the most important person in their healing, because they're the
Yeah,
ones that really understand their lives
they
and what they need
identify
to
with
do.
the illness. It's really
Yeah.
sad to see that they take it as an identity. So, for
Yeah.
example, I love that 12 steps program and all of that, but I have a problem with them insisting on uh, calling themselves I am an addict and I will always be an addict. This label of
Mhm.
like there's something wrong with me. I am not normal human being. This identifying
Mhm.
and turning into an identity, it's really devastating.
Yeah. Yeah. No, you don't want to do that. I think with the 12 step stuff, Having worked with people with addiction, I know I think I could imagine why they push that so much. And it's because people have so much resistance to stopping using the drug. And then they say, I'm just going to have one drink. I'm just going to do that. So I think they want the person to accept deep in their heart that you have no control over using it. And they just don't want to argue with people anymore. They say that you have no control over using it, you just got to get rid of it.
Mm-hmm.
Mm.
So okay, let's move let's move into different subjects. You know, my own story with suicide, and so that my brother died of suicide and all of that in 2018. You know, when I remember it, it's like I remember a story about my parents buying that antidepressants and believing that it will be the magical pill that will solve the problems of my brother. So they wanted to put it in juice or in something so he can ingest it without knowing. Uh, so I believe it's so silly, but I want to hear your own ideas about the role of psychiatry in dealing with depression, very depressed people, and who are suicidal and thinking about suicide. What is the best intervention to do with these people?
Yeah, so you have to understand why the person is unhappy now. For some reasons, sometimes it's really clear. You know, you talk to them and you understand their life, and whether it's relationships or it's work or there's some prior trauma that's gone on, which is haunting them. Sometimes it's as easy as that, but sometimes the depression just appears to come out of nowhere. In which case, you start looking at medical problems and diet. Um, and so I look at it in those two ways. And then you need to really support, and then you need to support the person and you need to be around them. Um, sometimes one of, the unfortunate thing that happens with the medications is because they sort of numb people out. If they have real problems going on, then the problems don't go away. Like many times the problems stay there and the person's just less empowered to kind of fix them and maybe even more confused about their agency in controlling things. And then the other issue with the medications is, especially in young people, they're much more likely to have paradoxical effects to it. So, I mean, sometimes the drugs may even make people more suicidal. If someone takes it and they have an unusual reaction and they're depressed and they become agitated, or sometimes the numbing of the medication um, is harmful because many people they don't want to take their lives because they're afraid of it. They're also afraid of the consequences for their families as well. But if you take a medication that is very numbing, sometimes they lose that fear as well. And so when you're using these drugs in young people who are having a lot of depression, gosh, you've got to be so careful and you need to constantly
Yeah.
be asking them, how is this affecting you? What are your thoughts like? Is this working? And so that's how I
If
think,
this is why that SSRIs
yeah,
has nowadays dark box, black box warning about suicide tendency, because
yeah.
I believe that the statistics tell that females, for example, have lower chance of succeeding at committing
Hmm.
suicide. I believe it's because they are
Yep.
fearful. They don't have the courage to do it because of their
Yes, yeah,
emotions.
they're a lot
So if
more.
I blunt the emotions, I give
Yeah,
I give the person. this is this is like, oh my God.
yeah. It can blunt the emotions. It can make them less afraid of death, and it can also make some people more impulsive as well. Um, and all of those things are bad when you're highly depressed.
Mhm. I can't one of the top questions in my mind when I heard your video, when I listened to your videos and all of that. What is the substitution right now? If psychiatry isn't working, what shall we do? What do you think about, for example, when I think about the history of humankind, uh, why in this time and in this era, we have this rise of people struggling with their mental illness? What is the problem with the environment itself? For example, social media. If you watched the Social Dilemma documentary on Netflix and all of that, what do you think about that really needs to change to improve the well-being, the mental well-being of people? I want to talk to hear your ideas about this problem.
Yeah, so I think it's a very complicated problem, and I think we can start with what are the reasons why people are so unhappy these days. And um, let's start with one thing that I don't think is on the radar, and that is that um, it has to be dietary stuff. I mean, we have to look at um, dietary problems. I mean, in the US, I think we're the most obese country in the world. We're riddled with insulin resistance. We have a lot of inflammatory problems, and a lot of these are diet related. And we spray all of our foods with glyphosates and pesticides, and you can just, gosh, I mean, autism is out of, I mean, I never remember seeing autism in the way that I'm seeing it now. I see so many children with autism now. And so that to me, I strongly feel like there is something going on
Yeah,
with
it's not
either
genetic.
foods. It's not genetic. There's some exposure going on. I think it's food related, but that's just a hunch that I have. So I think we need clean food that is not covered in pesticides, and we need to eat less sugar. So that would be the first thing. We need people to be physically healthy from better quality food. Now, there's a lot of other things going on, which um, and so let's talk about environment. We've never been more mobile before. People aren't living in their communities anymore. They're not living with their families. People are traveling for work.
Hmm.
They're moving all over the place. And I've personally dealt with this. And when you're constantly moving for work, you have loneliness and there's social isolation, and you're not with your friends anymore and your family and your supports. Um, Gosh, when I had a child, when my wife and I had our baby, we were by ourselves in a new place with neither of our parents around for work. She didn't have any friends. That was hard. And so I think there's a lot of social isolation going on because of how mobile we are. Um, I I also think I mean there's other things out there. I mean I think there's a lot of dissatisfaction with work. And then I do think people need more meaningful work, and they don't have that. I think there's economic problems. Gosh, the list goes on and on, and it's as long as a list as, why are people unhappy? And I think the people that are listening to this, they could probably identify the things in their life. They could say, well, this is hard and this is hard. Yeah.
Yeah, since you brought the issue of meaning, I believe that the one of the most contributing reasons for our suffering these days is that we lack meaning in our lives. Uh, for example, I believe that I studied the logotherapy and meaning for a lot of time, and even my book talks about it. The book that is currently being published. Uh, I believe right now that people are uh, like in a situation that they work something that is not meaningful to them. They are stuck in jobs that
Yes.
are not meaningful to them. We- So they just work for money, but they believe that what I'm doing is not helping someone else. I'm just doing something meaningless. I have no meaning in my life. I have no purpose in my life. So the famous Viktor Frankl, of course, talked about this, and also Carl Jung talked about it. How can we find more meaning in this bizarre time that we are living in?
Gosh, and it's one of the hardest things ever I think, to figure that out. But it's really important to try and move into a career or into some kind of work where you find meaning. And I mean, Freud gets a lot of criticism, but I think one of the things that he said that was really good was that there are two things that are important. And he says love and work. And that's true. It's your relationships and it's your meaning. And these two things, they're simple, but they can take decades to figure out, to find the right partner, to find the friends that you love, to find the work that you enjoy. You may even say that those things may be our mission in life, to find love and to find work that is meaningful, as the most important things that you do.
Yeah. And I also believe that for what happened recently in the Western world and on the spiritual side of things, people forsaking religion, people forsaking the notion of God at all. So for the whole human history, people used to take their meaning from having a relationship with something beyond them, religious activities and all of that. So when Nietzsche talked about this, when in The Madman, that he predicted that nihilism will take over humanity after the death of God. That people will, for example, my own brother struggled with nihilism, and because he didn't believe in God at all, and I believe that for this reason he committed suicide, because he felt that his life has no meaning. It's like everything will end. We are just these small creatures on this small planet, and the whole cosmos will be brought to nothing in the end. So, do you think that how to deal with nihilism? If even if someone doesn't believe in God, how can he not end in nihilism?
Gosh, that's
It's a hard question.
really hard one.
I'm sorry, but I'm
That's
thinking with you.
yeah, no, I know you're thinking out loud. I mean, I don't know if you convince someone to how you convince someone to come to that. But I do know that, church and religion, they are seeing a comeback in certain communities in the US because it has swung too far. I think a lot of people are waking up and they go, oh, well, I'm getting this paycheck, my bills are paid, I'm here, but what is the point of all of this? And I think I see more people being interested in Christianity over here and coming back to the church and doing things, just for that, because they want to hear that message every week, that message of meaning and purpose. They want to be with people who see, who share that as well. And so I do hope it swings back in that direction, because I really think that's important for people. But how to restore it when it's been lost, I don't know. That's hard.
Yeah, it's one of the main problems in our society right now.
Yeah.
Yeah, I believe.
Yeah.
Uh,
Yeah, it's like, I mean, I don't know, you shake them and you say, I promise you, you have a purpose. You may not see it yet, but you do. You're here for a reason. You're here to bring good into the world. You're here to do something special. You just say,
yeah,
I don't know. Yeah.
I really love Jordan Peterson when he talks about suffering in life, and that you need a meaning to justify the suffering in your life. When Nietzsche said, "To live is to suffer, to survive is to find meaning in the suffering," and all of that. I believe that The ability to deal with life hardships and all of that depends on meaning, on finding a purpose, some something to fight for,
Yeah.
something to justify this huge amount of suffering that I believe no one can can live without suffering. It's something crucial to life.
Yeah. I like Jordan Peterson a lot, and I like when he says that, because I think it's, that's what life is. It is suffering. It is hard. And if you expect that it's not going to be hard, and that terrible things aren't going to happen to you, the longer you live, the greater the chance that something terrible is coming around the corner. And that's inevitable for everyone. Eventually, something terrible happens to everyone.
Mhm.
Um, and I think that's important. I think that's a really important thing to remember.
So yeah, I believe so. To summarize this, I believe the substitution of psychiatry and psychiatric meds is to fix the problems in one's life and to find meaning and to be involved in healthy relationships and all of that. This is the
Oh,
history of.
sorry. Yeah. I was going to jump, and I remembered something because
Okay, go
because I
ahead.
don't know what it's like in Egypt, but I want to share. I actually feel like, in a really sad, twisted way, that politics has become almost to the level of religion in the US, where people aren't finding their meaning through God and the values of the church that they're in, but instead they're finding it through the values of their political party,
Mm,
because that's what people see now all the time in the news, on their phone. It's incredibly polarized in the US between the Democrats and the Republican, the right and the left. And I mean, it's to the point where, a few years ago, when COVID was going on, pe people weren't going to the holidays together. Families were split in half because one side said, I don't want to wear masks, and the other side said, I want to wear masks. Or it's one side says, I'm voting for Donald Trump. The other side says, I'm voting for Joe Biden. I mean, it was just this level that just the media and the politics in this country has become so powerful that almost seems to be one of the most important things in the
mm.
lives of people. It's not the church anymore or the meaning through that. It's like, what is their political party? And I think that is a terrible thing. I think it's awful and divisive.
Yeah, yeah.
Yeah. Yeah.
And also people who care for the environment and the extinction of animals and all of that. I believe that they are looking for religion in these things. That
Mhm.
my purpose is to save this animal from being from dying, and so yeah, people
Yeah.
like this. There is a gap in the human heart, and people will try different
Yes.
ways
Yes.
to fill this
There
gap.
is a gap. Yeah. I completely agree with that.
Okay, so we didn't talk about social media, but I believe it's really important to talk about social media nowadays and the effect of phone on the young people and all of that, and with the smartphone and social media. What do you believe about uh, this new phenomenon? And do you think that we should be giving smartphones to our children, and at what age? What do you think?
I mean, I don't think we should be giving smartphones to kids. I really wish we would just give them phones that didn't have social media on them so we could contact them. Because one of the problems I see with the smartphones is it's like a computer, it's entertainment that's with you all the time. And I don't think that's a good thing for a young person who is developing social skills, and who is also trying to um, find find purpose in their life as well. Because uh, I think you need to be bored. I think you need to sit there sometimes without
Yes.
entertainment in your pocket and be bored. So you go and say, well, I guess I'm going to go practice my basketball shots, or I'm going to go. I guess I'll call my friend on the phone, or I guess I'm going to talk to this person next to me on the bus and make
Mm-hmm.
small talk.
Yeah,
If you're constantly entertained and you never get bored, you never do any of these things, and you don't develop like a normal person.
yes, it's just entertainment and distraction. It was the existential philosophers
Mhm.
talked a lot about boredom and the utility of boredom. It's like the gateway to meaning, because boredom makes you ask
Yes.
the existential questions in life. So if I never
Yeah,
get bored,
being
how will I find purpose and meaning in life? I will never ask the questions. I will never
yeah,
seek anything.
yeah. Um, and those feelings, and I also feel like, I mean, some of the reasons people are driven to use their phones so much, it can be because they're lonely. It can be because they feel uncomfortable in their body and they're tense and they just like, I just need it to relax. It's almost like this drug that you use to numb these uncomfortable feelings that you have, rather than sitting there and going, why am I feeling like this? Oh, I need to go and be around people. I need to have friends. I need to make some phone calls. I need to not drink, 10 cups of coffee in the morning. So when the evening comes around, I'm so exhausted. The only thing I can do is sit down and look at my phone because I'm spent. It's just like this soothing drug in a way, and yeah, so it's bad. And I'm not above the rest of people. I mean, I scroll on social media on my phone as well, and it upsets me. And but
Mhm.
I also leave it I leave it in my house sometimes when I go out, just so I because it is important to be bored, because I want to talk to people, and I talk to a lot more strangers and people around when I don't have my phone, and I like that.
Yeah, exactly.
Yeah.
Okay. So finally, uh, how can someone struggling right now with tapering a drug um, get the help that he needs? And you provide, of course, you will say that he must do it with a professional psychiatrist and all of that.
Hmm.
But do you provide any okay uh, educational content to the psychiatrists themselves, so they can help people and be convinced that drugs are being harmful to them and all of that? Because many psychiatrists will say to the person, no, I believe that you should stay on the drug, because they are not educated enough.
Hmm. Yeah, so what I would say, so if you have a psychiatrist and you want to come off and you want to do it slowly, just tell them. You could just say, I'm someone who's really sensitive to drug withdrawal and I want to go slowly. That's the first thing you could say. I've tried to come off by doing larger reductions before, and it really didn't work for me. And so that's how you would bring that up. As for the actual advice on how you should get tapered, on our YouTube channel, Dr. Joseph, that's Drjosef, one of the playlists is called Tapering Tips. And it's just filled with videos showing how to taper different medications. And that will give you the confidence that to sort of ask your doctor how you want to be tapered. And it covers the whole thing. So the tapering tips playlist on my YouTube is all free information there.
Yeah, that's great. And also, do you work online? Can someone book a session with you online, or do you just work in your clinic? How can someone
Yeah, so
receive help from you online?
so they have to live in the United States and they have to
Mm-hmm.
live in one of the states we work in. And so that would be, if you want to see where we work, you go to taperclinic.com. That's TAPERCLINIC. And if you scroll down on the homepage, there's a map of the places that we work. And so you would need to physically be in one of those states. I mean, we have
Mm.
had international visitors come to one of those states before, but mostly we treat people living in the US.
So what is the future
Yeah.
of your clinic? What are you dreaming of doing more? Like tell us your dream, your vision about your clinic. I believe that
Well,
it
the big
it must need it needs to be international, so that anyone can find it from all around the world. Tell us more.
yeah. So there's a few things. One side of it is like the level of service that we offer. I mean, right now we help people in an outpatient setting with online groups. One day I'd love to have a hospital. I'd love to have a place where people could come for a few months, because doing all of the dietary changes and eating the clean food and getting the workup, that's really hard and that takes a lot of time. I'd love
Hmm.
people to be able to come to a hospital and do that with them and then send them home. And then the other challenge is one of expansion, and it's really it's training. You need to be able to train people to help people come off psychiatric medications, and that's a problem that I'm constantly working on. Is how do I educational platform so that doesn't happen. So it's easy to train people.
Okay. Any last thoughts that you would like to say before we end? Like tell us
No, just want to
like
yeah.
yeah, like if you give advice to someone who's struggling with this, what would you say to him?
Root cause is what I would say to people. Anyone out there who's having a mental health problem, um, don't be so quick to just accept that it's a problem with a broken brain. Take some time to think about where it's coming from. If you need to see a doctor for medical reasons, if you need to see a dietitian to look at dietary causes, if you need to see a therapist to work on your relationships, if you need to see a career coach to try and figure out how you're going to transition into work that's more meaningful, do those things. Oftentimes we don't think they're important because the doctors aren't telling us about them. But those are the most important things. And so root cause is what I will say.
Okay,
Yeah,
great. It's been a pleasure to have you here, and thanks for accepting this invitation. And I will leave a link to your channel and and your website in the description, so people can find you more about you.
no
Thanks.
problem. It was a pleasure. Thank you for having me.
Thanks. It's been a pleasure. It's been an honor. Thank you. Thank you very much.